Hello, dear friends. Welcome to our online weekly meeting with specialists of IVF Clinic. And today we are going to talk about frequently asked questions about IVF. So, just to start my presentation, today we decided to change our format of our online meeting. So today we will answer your questions. Just to remind you that we have an active chat, so you can ask all your questions and we will answer today them. So I would like to introduce our speakers today. Our head doctor of IVF Clinic, Galina Strelko, MD, PhD, obstetrician gynecologist, fertility specialist, member of ESHRE, ISMR and OARM, and also head doctor, as I said, and co-founder of IVF Medical Center. Our second speaker is Olga Chaplia, our embryologist, PhD, senior embryologist at IVMed Embryology Laboratory. She has ESHRE certified, she has ESHRE certificate. She is senior embryologist and also has 11 years of IVF and genetic laboratories practice. And also today we have our third speaker, Daria Hudkova. She is molecular biologist, andrologist, and IVMed Andrology Laboratory, and she's a specialist in the diagnosis of pathologies of male infertility. She also performs sperm tests, including DNA fragmentation testing, oxidative stress test, and prepares material for IVF. So I would like to start our webinar with the first question that we received from the email. Just a second, I'll open my... And the first question will be for our doctor, for our head doctor. And just a second, I'll find the question. So, the first question, can the last injection affect the stimulation result? I'm 38. Last time I had 15 follicles. Last injection was differently, and I didn't get any egg cells. My doctor said that my ovaries didn't respond to the medicine. Maybe next time I need to change the stimulation medicine. So the first question will be to our fertility doctor about stimulation.
Okay, thank you very much for this important question. It is very interesting situation. Not very often we can see that, but sometimes we have this such kind of situation. It is due to LH level in most of case. If LH level basically is very low, and at the end of stimulation also LH level is less than 1 or maybe 2, it may be that after agonist of GnRH injection for final oocyte maturation, your organism will not produce LH surge. This is one of explanation. Another possible explanation that, for example, you have done your injection not correctly. It may be different possibility how it may be done not well, but if you have done by yourself, sometime maybe some technical mistakes. Also, in this case, you will have very low level of agonists of GnRH in your blood, and also it will not provoke LH surge. Normally, we can control that if we will do the injection of agonists. Next day in the morning, we ask our patients to do LH test, ovulation test also we can call it. It is absolutely available in any pharmacy, or maybe doing the blood test with dosage of LH level. Normally, if your LH level more than 15, it may be enough to produce the final oocyte maturation. But if less than 15, it may be that we will not receive eggs. So this is one of the explanations.
Okay, thank you for your answer.
But about HCG injection, it is possible that HCG, in this case, another kind of trigger for final oocyte maturation, may produce good response and will be possible to receive oocytes. But the problem that we have no possibility to know before exactly if it will act or will not act. Normally, doctors propose to do like that. If injection with agonist doesn't work, they propose to do next time the injection with HCG. But unfortunately, in some case, particular case, it is also maybe not effective.
Okay, thank you. And we have a next question. How do I find the right IVF clinic for me? And I can answer that question as the medical coordinator. And actually, there are several criteria. And first one is medical certification and license. You need to be sure that your IVF clinic documentation and all certification. Next criteria is treatment options. For example, you need to understand clearly and properly the whole process of the treatment and to understand all your possibilities. For example, you can arrange Skype consultation with our fertility doctor or with a specialist of IVF clinic, and you can be at home, and before you visit Ukraine, for example, you can know all the answers to your questions. And another criteria is success rate. You also need to understand the general success of IVF clinic, but also it's better to understand your personal success rate, because your success rate also depends from your health, from medical conditions, from your previous history. And also you can talk about that with your fertility doctor. So there are several criteria, and it seems that it's hard to find the right clinic, but actually, if you follow them, it will be pretty simple. So, and thank you for your question. And our next question, if there a way to increase egg quantity if I have low AMH? I think it's also a question to our fertility doctor, Dr. Galina, please.
Okay, this is quite often patients ask about that. Interesting question, and we should say that the quantity of eggs in general, we call that ovarian reserve. We cannot change a lot. Only that we can influence, it is the rate of apoptosis of these eggs, because normally the length of eggs maturation and growing take around 12 weeks. And only last 2 weeks we can influence by different way. Generally, before 37.5 years old, every month start around 1,000 of follicles, and then till ovulation arrive 10, 15, and last 2 weeks, only one became dominant follicle and other also go to the atresia. So we can try to influence this rate of atresia. So what it can be, for example, vitamins. We know well that vitamin B, E, folic acid may improve situation with ovarian, with antral follicles atresia. We know also that most of our patients have low level of vitamin D. So if we will take supplements like vitamin D, E, it may be helpful. Second, which we can do, this is improve blood circulation by different way. Maybe some kind of medication, maybe some physical activity, maybe some yoga or some Chinese therapy, herbal therapy, gynecological massage, any kind of possibility, any kind of intervention which can improve blood circulation may be helpful to decrease the level of atresia. Also, there are a lot of publications about some supplements like testosterones, different kind of testosterones, and in some publication, authors show that it may improve the quantity of antral follicles. Sometimes we can give replacement hormonal therapy, and also in some cases we can see the improvement. Also, we can use growth hormone 1-2 months before to start the stimulation. Also, there are some publications where it was shown that we have more eggs and better quality if we have this kind of preparation. But necessary to say that all this intervention will not improve the ovarian reserve dramatically. If we can see, for example, 1-2 follicle, maybe after all that we will see 3-4, but not 15, unfortunately. So the possibility of all these interventions is quite restricted, quite limited.
Thank you for your answer. So, we have the next question for our embryologist, Olga. Hello, if the eggs have poor quality, can you freeze them?
Yes, we can freeze eggs if they are mature, because it's the most important condition for oocyte selection for freezing. Even if the eggs are not of the perfect quality, they probably will survive the process of freezing and sewing, because modern protocols are very effective. They help us to get almost 95% of oocyte survival after freezing and sewing. But from the other point of view, if you have eggs of low quality, there is a chance that you may have also the embryos of low quality. And usually patients who have frozen oocytes also have hopes, and they expect that these oocytes may be used for successful IVF treatment and pregnancy occurrence. So it should be taken into account. If your eggs are of low quality, that is probably wiser to produce embryos and to see, are they able to develop to blastocyst stage? Are they able to form blastocysts of good quality? And after that, to freeze embryos. But of course, it depends on many factors. Still, when we talk about selection of freezing protocol, it is more efficient to freeze embryos, because at least you know what you can expect for and what you're gonna get after fertilization and what you will get for the transfer. So yes, we can, but it's better in such situation to go for IVF first. Thank you.
Thank you for your answer. We have a lot of questions, and next one, my husband did sperm test and he has morphology 2%. Can it affect ICSI? Can you choose the best sperm for fertilization, please? Daria, our andrologist, answer the question.
Thank you for your question. No, it's not. It cannot affect the ICSI process, because we using different types of sperm preparation, such as density gradient centrifugation, which can help us to get the most beautiful spermatozoa and with good motility. And also we using sperm chip for such cases with bad morphology. And during the ICSI process, our embryology is trying to choose the best spermatozoa for fertilization, and that's why the result is always good. So it's not gonna affect.
Thank you for your answer. We have the next question, also to embryologist. I am 28 years old. My husband is 32. We did all tests. Everything is fine, but I could not get pregnant. We decided to do IVF. After stimulation, I got 20 cells, but only 5 were taken from them for fertilization. Why?
It is very difficult to answer this question because we actually lack some information. Probably it means that among all the 20 cells that were taken during OPU, only 5 were mature and ready for fertilization. But the other 15 may be, for example, immature or degenerated or of very poor quality, and these factors really influence the prognosis. For example, the pathology of oocyte maturation may be genetically influenced, or maybe, for example, due to a physiologic condition, for example, polycystic ovary syndrome. And in such case, it is always better to go on and to have some other health tests and to have consultation with obstetrician, gynecologist, to see if the treatment was appropriate to your health state, and if we, for example, need to change some stimulation protocol. If the oocytes the other 15 oocytes that were not subjected for fertilization were degenerated at the moment of OPU or after denudation, is a special process that helps us to relieve oocytes from the surrounding cells and to see if it's mature. That probably may be connected to plenty of different factors that we may not or may influence. And in order to do something, we should get more information, more consultation with doctor, and of course to see the whole protocol in order to explain why such situation may happen. But according to the rest 15 cells, different reasons may be the explanation of such a set event. Still, even having 5 mature oocytes for fertilization, we can get good embryos and pregnancy as a result of treatment. That's what I wish to you. Thank you.
Thank you for your answer. We have a next question to a doctor. I'm overweight. I can't get pregnant for 5 years. Can I do IVF, or it's better first to lose weight?
Good question. Thank you. So normally overweight people has different problem with health, like diabetes, like high blood pressure, like problem with steroid, etc., etc. And all these problems can influence the health of future baby during the pregnancy. So, of course, it is better to try to decrease, to normalize your weight. But from the other hand, there was very interesting study a couple of years ago, and was shown that one group of patients tried to become more slim, and another one proceed directly to IVF. And this group, which arrived to decrease a little bit their weight, has finally a little bit more complication during the pregnancy than people who doesn't try. So it is not so easy, this question. Why necessary to do analyze? Because maybe people who try to become more slim was more stressed, more, I don't know, not eat correctly, try to eat less, etc., etc. So finally, if we compare the results of treatment of two groups of women, slim and with and overweight, we will see the difference, because women who has more than body mass index more than 24.9, it is normal body mass index, will have much more complication, and it is depend how much their weight exceed the normal range. But if we discuss about preparation to IVF treatment, sometime quickly and extreme weight loss may, how to say, not improve, or even maybe sometime decrease the chance. So it is not so easy question. Necessary to see case by case.
Thank you for your answer. We have next question to our andrologist. My husband has DNA fragmentation 28%. We are planning to do IVF. My doctor recommends using a sperm chip. And do you have this technology in your clinic? Please, Ria.
Yes, thank you for your question. Yes, we do sperm chip in our lab. This method is a good option for increasing the fertilization and ovulation rate using only selected spermatozoa which have successfully overcome barriers which imitates female reproductive pathways. So it's better because using sperm chip as a method of sperm preparation does not cause any injury, mechanical injury during, for example, centrifugation, and it doesn't harm physically alive sperm, which can cause some mechanical injury and create oxidative stress. And that's why using this sperm chip in your situation is a very good option.
Okay, thank you for your answer. We have another question for our embryologist. Hi, I have 3 embryos. One is 5th day, 5AA, 2 are 6th day, 5BB, and 5BA. Can I transfer the embryo 5th and 6th day together? I did PGT5, all is fine.
Yes, you can transfer embryos of day 5 and day 6 together, because in order to implant, embryo should reach a special state called blastocyst. Embryo may form blastocyst on day 5, day 6, and sometimes on day 7. And at this stage, embryo is able to communicate with the endometrium that is also ready to communicate with embryo. And it really doesn't matter at what day embryo reaches blastocyst stage. Is the fact that it's able to form blastocyst. So you can combine embryos of day 5 and day 6, and they will be ready to implant at the same level, independently of the day of their culture. Thank you.
Okay, thank you for your question. We have a question to our andrologist. If DNA fragmentation is high, what can you recommend? Tesa or sperm chip?
It's a little bit difficult question, and mostly it depends on the DNA fermentation level and also on sperm test result. If there are enough progressive motile with a good morphology spermatozoa and in case from 30 to 60% of DNA fermentation level, it's much more better to use a sperm chip sorting technique. If, for example, your DNA fragmentation is higher than 60%, here is better to get a consultation with a doctor andrologist. He will find a way and discuss with you all possible optimal decisions. So it depends on the result of the tests. Thank you.
Thank you for your answer. Just to remind you, on our YouTube channel, we have our webinar online meeting about microTESA and spermogram. So if you want to know more information about this, of course, you can send us all your questions. And also you can check our webinar on YouTube channel and to know more about the procedure. So we have our next question to our doctor. Can Q10 and DHEA improve fertility?
Yes, that's about exactly these supplements we were talking a couple of minutes ago. It was a lot of publication about DHEA. First, Professor Gletscher from USA showed that using this DHA may improve dramatically fertility. After was shown that not so dramatically. After was shown that okay, it is some patients react, some not react to this treatment. And now most of publications say that better to use transdermal testosterone instead of DHEA. It is more effective. So rise and no, but some preparation of testosterone may improve fertility. Speaking about Q10, the mechanism of action to decrease oxidative stress and to decrease free radicals activity, and it may improve maybe quality of eggs, not quantity. Maybe it will improve a little bit blood circulation, but about this, not a lot of double-blind randomized trials, so difficult to say exactly. Of course, it is supplement, so you can use it safely, and maybe it will improve a little bit the situation.
Thank you for your answer. We have also a question. Do you have egg donation guarantee programs? I had several IVF tries, but without any success. I want to be sure that I get pregnancy. I can answer that question. Yes, we have egg donation guarantee programs. There are several of them. We have two programs that guarantee one embryo transfer or two embryo transfer, and also one guarantee program that guarantees till pregnancy till 12 weeks. But you need to understand that there are several requirements for women's health to do the guarantee program. And firstly, you need to send your medical documentation, your blood test results, your medical history for your medical coordinator, for example, through the email, so we can arrange a Skype consultation with a doctor, and doctor will decide if you can do the egg donation guarantee program or not, because there are several requirements. And we have, but there are some requirements, and we need to arrange that in advance. So, and we have also another question, that guaranteed program, but use own eggs first. Unfortunately, we have only egg donation guarantee programs, and there is a reason for that. When we use donor egg cells, we use the best cryopreserved eggs, and we can be sure the quality of these eggs. But when we use own eggs, we can't be sure. And as I said before, there are several requirements for health, and that's why only with egg donation guarantee programs. Also, if you are interested in egg donation programs, we also had a webinar that we made before, and you can check our YouTube channel. I went my eggs first before moving to donor. You can try your own stimulation, and then you can try egg donation program. It's not a problem. Actually, everything depends on your medical reports and medical history, because as our doctors said before, for example, it's hard to answer such questions because we don't know the possibility if you can do your own stimulation, use your own eggs. So thank you for your questions. If you have some additional questions, please feel free to ask us in the chat. And we have a question for embryologist. How does embryologist understand which embryo to transfer and which to freeze? Olga, please.
Basically, in order to understand what embryos to freeze or transfer, we should take into consideration its morphology. It's the structure of the embryo that we can analyze with our eyes or with the help of the special system that is called time-lapse. And we have it in our IVF laboratory, so we can use it very actively. And also, in order to understand what embryo we should freeze or transfer, we also can rely on a genetic component of embryo, but we can be sure about it only in case we have done a biopsy of embryo cells on day 3. that we actually perform quite rarely because it's recommended by international societies to switch to day 5, day 6 biopsy. So basically, in order to determine what embryos to freeze or to transfer, we take a look at their structure and take the best, while others that are not good or stop their development are discarded and are not subjected for transfer and for freezing. This to be brief.
Okay, thank you for your answer. We also have a question for our andrologist. If sperm test is enough for IVF, do we need to do DNA fragmentation test or other tests to prepare for IVF?
Hi, sperm test unfortunately is not enough for IVF processes, and I'm trying to explain why. Firstly, in case of low rate of fertilization and postulation, we need to find a reason why it's happened. So to predict such a situation, it's better before IVF processes to do all necessary analysis, such as DNA fragmentation, to measure oxidative stress, and to do morphology tests. And secondly, after all, for example, if we can find in result, we can find the result is not very good, we can use additional methods of sperm preparation, which can help us to reach high level of fertilization and postulation rate. So that's why it's better to make all of these tests for getting the whole picture of situation and going through IVF process is much more careful. So thank you.
Thank you for your answer. And we have additional questions for our guest. How about shipped embryos? Firstly, I will answer that. Yes, you can ship embryos in our clinic, but also firstly, before that, we need to have embryo protocol and your blood tests before you made embryos, because we need to send all the information for our embryologists. They need to check if we can receive these embryos from other clinic. And also another question for embryologists: can we freeze third day's embryos, send them in your clinic, PGD test them, or should we do PGD test here before sending them? What's the odd? Please, Olga.
Basically, two options are possible. You can freeze embryos on day 3, ship them to our clinic. We will sow them and will culture them subsequently to day 5 and day 6, perform biopsy on blastocyst at blastocyst stage, do PGD testing, whether it would be PGD 5 or 9 chromosomes or whole chromosome screening, and freeze embryos. From the other point of view, you also can culture embryos to blastocyst stage at the clinic where you are going for the OPU, do PGD test there, and send us the embryos that are considered to be euploid according to PGS that you've done in the first clinic. These options are, I would say, quite similar, because we will transfer only euploid embryos, only embryos that will be considered to be healthy, that will reach a special embryologic stage named blastocyst. Well, maybe there are some kind of difference if we talk about shipment, convenience, price of the procedures, and maybe the basically techniques that are used in your IVF laboratory and our IVF laboratory, because it's the result of PGS testing is strongly dependent on the technique of the biopsy also. So the embryologist should be trained, very well trained, according to the to do biopsy well. And that's actually what we do in our laboratory. We have experienced staff about it. And also you should consider the rules, like the legislation of the country where you're from, because in some countries, PGS testing, especially those that reveals, for example, the sex of the embryo is strictly prohibited. So it's not possible to do it there. Please take a look at these rules. And then you probably can talk to our doctors, for example, with the help of the Skype, and to choose the option that will be more convenient and more efficient to you.
So we have the additional, yes, that's my country. It seems that our guest is from that country, that they can't do PGT testing. The question, which is the safest option? So Olga, can you please help? Australia. So they can't do in Australia the PGT testing, and which is the safest option for our guest.
You don't have to worry, because nowadays all the shipment procedures, especially when you go for a high professional companies that perform frozen embryo and frozen oocyte shipment for years, they can guarantee you the safety of embryo transport. Even from Australia to Ukraine, we often even love that some embryos travel more than embryologists before they even implant. But from the other point of view, also, if you are talking about Australia, there are some differences in freezing techniques, because some countries use only closed systems and some countries use open system. So as an embryologist, to be honest, I prefer to get embryos on day 3, to culture them by myself and to do biopsy and to see what I'm working with and what to expect after sewing. But from the other point of view, of course, I am pretty sure that in Australia, embryologists work very well too. So you basically can go with blastocyst biopsy there. It's two options that are quite, I would repeat, they are quite similar, but from the point of the working embryologist, it is always better to know what you expect to get after sewing, and you can only know it when you see embryos before freezing. So it's like kind of personal moment, but still, at least we can rely what we see and what we get after sewing. That's why I prefer day 3 embryos shipment. Thank you.
Okay, thank you for your answer.
One comment for that. Theoretically speaking, maybe the situation when after shipping, arriving in Kiev, sewing and producing blastocyst, and after all that procedure, we will understand that there is no healthy embryos. And the patient can spend money for shipment, for cultivation, etc., etc. So from this point of view, maybe better to have full information about embryo before shipping in Ukraine, because procedure of shipping is quite difficult and expensive, and we should do a lot of papers. Patient also prepare a lot of papers. So necessary to take in consideration also this moment.
Okay, thank you. So actually, basically, you can choose any option you want. And the question also, do you work with a particular shipping company? Actually, there are a lot of them. If you need any recommendation, you can send us an email and we can check shipping company and find the right option. And also we have another question to fertility doctor. I'm 36 years old and my husband is 40. He has a healthy child from first marriage. We are trying to get pregnant for 2 years. My AMH is 2.3. My husband has normal sperm quality. What can you recommend for us? Maybe we should try intrauterine insemination, or it's better to do stimulation. I think the meaning is like own stimulation.
Okay, I will try to answer. There is some, how to say, rules written by Eshre about the woman's age and procedure which we can propose to patient. If woman has less than 36 years old, we can try to receive the infertility problem by different way during 1 year. But if woman has more than 36 years old, ESHRE, European Society of Reproductive Medicine, recommend to move more fast because the quality of eggs start to decrease, the quantity of eggs start to decrease, and this period of trial should not be more than 6 months. The probability to receive positive test after intrauterine insemination is not very high, around from 5 till 10%, depends on sperm quality, etc., etc. So the probability to become pregnant after 3-4 consecutive intrauterine insemination is no more than 10-15%. So if ovarian reserve is good, in this case ovarian reserve is not bad, IMH 2.3 is okay, you can try 2-3 procedure of intrauterine insemination, and necessary to understand that probability to receive pregnancy is not very high. But if after 6 months and after 3-4 trial of intrauterine insemination you will not become pregnant, better to move to IVF treatment, because one IVF treatment program give the same pregnancy rate as 1 year of different other trials and attempts and simple treatments like intrauterine insemination or simple stimulation. So IVF give you, how to say, works more quickly. In some time, in some situation, time is crucial things, and like that. After 6 months, necessary to try IVF, but before you can try EUE.
Thank you for your answer, and we also from our Australian guest, they can't do the gender selection, but you can do PGT testing in Ukraine and to know not only about the some abnormalities in the embryo, but also about the gender. And question to embryologist: I want to do IVF with egg donation. What is better, to use fresh or frozen eggs? Yes, to use fresh or frozen eggs, please. Olga?
I would say that it really doesn't matter what oocytes you use, fresh or frozen ones, because of course there are some pros and some cons for every option. When you do ICSI with fresh eggs, you usually stimulate a donor, especially for you. That is kind of positive thing. Oocytes don't go through process of freezing and so on, though they are safe, but still it takes time. It takes some, I would say, tiny amount of oocyte energy to go through this process. But from the other point of view, when you go with the frozen eggs, you are sure that these eggs are of high quality, because in our laboratory we have a very strict selection criteria for oocyte freezing, and it really helps us to reach the same efficiency level for frozen and fresh oocytes if we talk about donor and even patients program. So basically in such situation, from the embryologic point of view, there is no major difference, but there is difference in the planning, in health conditions that you should take into account, into your time convenience, and all these moments that probably will account for more compared to any other embryologic moments, because, as I already said, frozen and fresh oocytes in our laboratory are of high quality anyway.
Okay, so thank you for your answer. And it seems that we answered all the questions. Just to remind that the video of every webinar you can find on our YouTube channel. Okay. not about the topic, so we can find out if it's difficult time. We are the, sorry, I just don't understand the question from Alma, and if you can explain for us if your question, what your question is. So just to remind that we have all the webinars on our YouTube channel, so you can check and to listen one more time. And also we have an email where babies recently born. Sorry, I can't I can't get the question.
Maybe it concern of surrogacy and baby born after surrogacy.
Ah, who is taking care? Okay, I get that. Okay, thank you. You shouldn't be worried. We have, yes, we had babies who were born through surrogacy during this pandemic and quarantine time, but actually most of the parents are already in Ukraine. We had already babies are with their parents, and with babies before were in the maternity hospital, because it's specialized place where doctors, neonatologists, pediatricians can take care about the babies. And yes, there are a lot of videos where children in the hospital or somewhere with nurses. Every clinic has different opportunities and find different ways how to take care about the babies that were born through surrogacy. But I can say only about our clinic that firstly, thanks God that parents are already in Ukraine, and actually we had parents from Australia also, and they already had birth certificate of the baby and happily with their babies. So according to us, it's better that babies are in the clinic under control of the doctors, nurses, and so forth. So yeah, it's quite hot topic nowadays, but everything depends on the clinic, on the agency. That's why I talked before about how to choose, for example, a fertility clinic. So you need to be sure that everything is done according to the law and had medical certification and so forth and so forth. So we will end our webinar and answered all the questions, and thank you for our wonderful speakers for all your answers. And I'd like to invite our guests for our next webinar next Friday, and we also will answer all your questions about IVF, infertility treatment, and so forth. So have a nice day and have a nice weekend.